Hello, everyone. Thank you for joining today's presentation from the Health Connector. The name of today's presentation is Health Connector for Business, Affordable, Flexible Health Coverage. We do have a number of participants who have signed up to join today, but we will plan on getting started at 12 o'clock as scheduled. So again, welcome everyone. I am Melissa Stearns from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Shaitra Sanders and Nikki Conti, and we are here to help answer any questions that you might have. So I'd first like to take a moment to thank chambers, business organizations, and brokers across the state for their support in promoting this webinar. So before we get started, just some information about our presentation format today. First, everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 25 to 30 minutes. After that, we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout the presentation there. Please do not disclose any personal information or protected health information when you ask your question, as we will not be able to answer those in full detail here on the webinar. If you have a specific personal scenario that you want to discuss with someone, we will be providing contact information for the Health Connector's customer service centers, as well as instructions on how to find help from a local broker or navigator. We are recording today's webinar, so following today's presentation, you will receive an email with the presentation, so there's really no need for you to take detailed notes at this time. Before we get started, if you wouldn't mind taking a few moments to answer the poll question that will pop up on your screen, we would greatly appreciate the feedback.
Melissa, I put through the poll. I'm not sure if you could see the results, but yeah, it looks pretty interesting. I see a lot of people got this information from other, which I'm curious to see what those others were. I think at the end of this presentation, we'll be able to see maybe a fill-in, so that'll be interesting. And business associations. So very interesting.
Definitely. Okay. Well, thank you all for your feedback on that poll question. Much appreciated. Let's go ahead and get started with today's presentation.
All right. Thank you so much, Melissa. And you'll be joining us again, I think, for question and answer at the end. So we'll see you a little later. I'm going to go ahead and get started on the presentation, Health Connector for Business, Affordable, Flexible Health Coverage. And then as Melissa stated, my colleague Nikki Conti will jump on to provide some information on what's available for sole proprietors, owner-onlys, part-time employees who might not have access to employer-sponsored coverage through Health Connector for Business or elsewhere. So just a quick overview of what we'll be going over, Health Connector for Business in general, what the employer's experience has been with the Health Connector for Business, some of the great benefits, as you can see listed there, savings, flexible choice, rebates, small business tax credit, then how to get started after you've heard all these great items, and then again, the Health Connector options for sole proprietors only, owner only. So what is the Health Connector? Just to review for all of you who might not be familiar with the Massachusetts Health Connector, it is the state's health insurance marketplace. So the Health Connector is a platform where you can come to. It offers individuals, families, and small employers access to affordable health insurance coverage. So what we'll be discussing today is businesses offering coverage to their small groups, so 50 or fewer employees, through the Health Connector for Business. Also, we'll have access to explain to you what is available for people who do not have access to health insurance through their job or other sources, and they may apply for individual coverage. Also, many people who apply qualify for help paying with savings through the American Rescue Plan, and also dental insurance is available through the Health Connector. So we'll be talking about health and dental. What carriers are available at the Health Connector? So if you take a look here, just to let you know, we offer plans through all the leading insurers here in Massachusetts with exclusive cost savings and flexible choice benefits. So as you look here at the screen, many of these logos will be familiar to you because these are the leading insurers here in Massachusetts, and they are available on the Health Connector, both the Health Connector for individuals and families and the Health Connector for business. So depending on where your business is at or where you might live as an individual, it will show which plans are available to you through these carriers. So I'm sure you're familiar with all of these, if not most of them. So I'm gonna go into detail about Health Connector for Business. And then, like I said, Nikki will jump on and explain to you what's available through the Health Connector for individuals and families for those who can't get health insurance through the Health Connector for Business. So let's talk about a little bit of the benefits of utilizing the Health Connector for Business. First of all, let me just reiterate that the Health Connector for Business is designed for employers who have 50 or fewer full-time equivalent employees at initial enrollment. And what we do is we seek to maximize access and affordability for the small employers. Here are 6 items that we have found that are true benefits of utilizing the Health Connector for Business as a small group here in Massachusetts. 1, full carrier participation. As I stated on the previous slide, the Health Connector for Business is the only place where small groups can actually access every single leading carrier in the Massachusetts marketplace. Also, we provide competitive premiums. What we have found from surveys that we have given over the past few years is small businesses save on average 20% before any rebates by shopping through the Health Connector for Business. And that's through comparison shopping, which I'll talk about a little bit more in detail. There's also wellness rebates available through the Health Connector for Business. Employers actually may be eligible for a 15% rebate of their premium contributions if their employees complete one of 30 pre-approved wellness activities. So that's money back for offering health insurance and for promoting wellness in the workplace. And that's exclusive to the Health Connector for Business. We also have flexible employee choice models. These are exclusive to the Health Connector for Business. And what it does, it allows for an employer to control their costs or keep them constant while providing their employees with options to shop from for different plans that would best fit the employee's need. And I'll talk about that in a little bit more detail as we go along. We also have free certified assistance on the Health Connector for Business. We have over 460 certified brokers available to help at any point, and they are actually available to you for free. So you can utilize them for any Health Connector for Business related item, and they will be able to offer you that assistance for free and give you the best options for yourself and your employees. Also, keep in mind that when you are offering a plan to your employees through the Health Connector for Business, employers can feel secure that they are offering a plan that meets all federal and state coverage requirements. So there's peace of mind there. And just to pull out some of those plan highlights that are available through the Health Connector for Business, we have health savings account compatible plans. So if you are a business that might already offer or are thinking about offering a health savings account plan, and just to let you know what a health savings account plan is, it's a tax advantage medical savings account plan for those who are enrolled in a high deductible health plan. On the Health Connector for Business, each carrier that is available offers at least a silver HSA compatible plan. So you know that there are plans available to your employees if you also offer the health savings account benefit to them also. There's also out-of-state coverage available. So Health Connector for Business offers out-of-state coverage through their PPO plans, preferred provider organization plans. And to access that PPO plan for employees to be able to enroll in it, employers will need to offer the one carrier model. Again, I will talk about those employee choice models in the coming slides. And just to reiterate, this is coverage you can trust. So just be assured that all Health Connector for Business plans are compliant with state and federal law. They meet the state's minimum credible coverage, and they have received the Health Connector seal of approval for quality and value. So those are all great things to know. Those are a few of the highlights. Now, if you were not offering coverage through the Health Connector for Business and you wanted to make sure that your plan met state minimum coverage standards, you would need to look for these 10 essential benefits through the plan. So these are the minimum coverage standards: office visits, emergency services, hospitalization, maternity and newborn care, preventative services with zero cost sharing, pediatric care, prescription drugs, rehabilitation services, lab services, mental health, and substance use treatment. Those are the minimum coverage that you have to look for to meet the state's requirement. But on the Health Connector for Business, you don't have to look for it because we just confirmed that all of the plans will have at least these minimum essential benefits, maybe more also. So let's talk a little bit about what we've been hearing back from employers who have shopped on the Health Connector for Business. What are employers experiencing? So I think I stated before in maybe the very first slide that employers have found that they can save on average about 20% by offering health insurance through the Health Connector for Business. And the lead reason for this is comparison shopping. So what it is we are a marketplace. So like I showed you before, we have access to all those leading insurers, one place. So when an employer comes on, they will see all of the carriers that are available to them based on the business zip code. And then they'll be able to play around with some quotes and stuff and see what will cost the business. Having all of these at their fingertips in one location has led to an employer saving more on average. And so that's kind of what this describes. This chart just really kind of just shows you based on metal tier, the savings that employers have seen on exchange, who is the Health Connector for Business in blue, in comparison to off exchange, which is the green bar in for anything not Health Connector for Business. So there is savings to be had through comparison shopping, and there's ways to quote that. An anonymous browse tool that we'll talk about, writing your employer account when you create them, and also your broker quoting them for you. Employers have also responded back that they like certain benefits through the Health Connector for Business that have brought them on and had them offer health insurance to their employees. The employee choice models are one of the major reasons for offering health insurance through the Health Connector for Business. As I said, I'll talk a little bit more about that in the coming slides, but the key here is employers get to keep their costs constant while offering their employees the option to shop for different plans that fit their needs. Rebates, the Connect Well rebate, that 15% rebate, that's a great little like incentive to offer health insurance to your employees and promote wellness in the workplace. Tax credit, there's a small business healthcare tax credit through the federal IRS. Only businesses that shop through a state marketplace, which as I stated before, the Health Connector for Business is a state marketplace, can be eligible for the small business healthcare tax credit. So there's another great benefit. Also, there are no fees or membership dues. To utilize the Health Connector for Business, it is free for you to utilize. You just have to pay the premiums. So you don't have to pay a fee to utilize the Health Connector for Business. You don't have to become a member to utilize the Health Connector for Business. You don't have to pay. So I think I've mentioned employee choice models a few times in this presentation so far. So let me tell you what the employee choice models are. So remember, employee choice models are exclusive benefit offering through the Health Connector for Business. You can't find these anywhere else, just through the Health Connector for Business. And the goal of the employee choice models, as I've stated before, is to allow for an employer to control costs while providing multiple insurance options to their employees. You might think in your mind, oh my goodness, how can I provide multiple options to my employees? Won't that get confusing? Well, everything on the Health Connector for Business is online. No paperwork, no gathering anything. So employees will have accounts that they can easily compare the options and choose a plan that best fits their need, fits their doctor network, the benefits that they need, the amount that they're able to pay on the premium. All of that is encompassed in an online account that they'll be able to compare what's available to them. So easy to compare. What are these plans? What are these employee choice model benefits? So they are called one plan, one carrier, one level. I'll explain it really quickly in these terms, and then I'll break it down and compare it to pizza. So one plan is where the employer chooses everything. The employer will choose the plan, the carrier, and how much the business is going to pay into it. And then the employees will either enroll in that plan or not. So that's just one option. The employees don't get to choose what they want. They just get to choose whether they're going to enroll in the plan or waive with a valid waiver. One carrier is where the decision maker, the HR, the business, gets to choose which carrier they're going to offer all their employees. Then within that carrier, the business will pay a contribution percentage into one of the plans. We call that the reference plan. You can call it your base plan, your budget plan, whatever you'd like, but that's the plan that the business is responsible for. The employees can then buy any silver, gold, or platinum plan outside of that reference plan and pay the difference. One level, very similar to one carrier, but instead the business is making the decision on which metallic tier, so silver or gold, to offer their employees. The business will then pay a contribution amount into one of the plans from a carrier at that tier, and then the employees can buy across carriers at that tier and enroll in the one that best suits maybe their network need, which carrier has their doctor, and they'll pay the difference outside the one that the business is paying into, the reference plan, the base plan, the budget plan, whatever you'd like to call it. So, like I said, we're going to take those insurance terms and turn them into pizza. So how does one plan work? So imagine you and your employee decide to share the cost of a pizza. Keep in mind, your employee is getting this whole pizza. So the employee's not sharing the pizza, the employee's getting the pizza, but you decide to share the cost of it. So with one plan, let's say you decide on a $10 pepperoni pizza from the pizzeria down the block, and you say to the employee, you'll agree to pay for half of the cost. So if that pepperoni pizza from the pizzeria down the block is $10, you'll pay $5, the employee will pay $5. The employee will get the pepperoni pizza, but it will be from the pizzeria down the block. So that's it. The employee just chose to take the pepperoni pizza from the pizzeria down the block. You pay for half, they pay for half. That's how one plan works. So this is how it kind of look when you are looking at health insurance options. This example in particular shows that as the employer, you chose a gold plan from this carrier you're going to pay a contribution percentage into it, and the employees will pay the other percentage for it. So there's no real choice here. They're going to pay into that gold plan from that carrier and get enrolled in that. So that's one plan that is available through the Health Connector for Business. How does one carrier work? One carrier is where you, as the decision maker, the employer, the HR person, decides what carrier you're going to offer to everyone. So in pizza terms, you will decide what pizzeria the pizza is coming from. So you will say, I'll share the cost of pizza with you. You'll get the pizza, but it's going to come from this pizzeria down the block. I looked at the menu. The business can afford to pay for half of the $10 pepperoni pizza. So we've got $5 to give you towards the pizza. Your employee can then go ahead and shop from that pizzeria, and they can buy any pizza from that pizzeria and use your $5 towards it. So they could go ahead and get the pepperoni and pay the other $5. That's fine. Or maybe they want a cheese. Maybe the cheese is $8. So you've given them $5 towards the pepperoni, and then they'll pay the other $3 for the cheese. Maybe they want the Supreme. The Supreme might be $15 in this case. And so you've given them $5, but if they want the Supreme, they're going to have to pay $10 for it. So that is pretty much what it is. You chose the pizzeria, they chose the pizza, and how much they wanted to put towards it outside of your contribution. And so this is what it looks like when you're offering health insurance. You will choose the carrier. You will choose a silver, gold, or platinum plan within the carrier to pay your contribution into. And then the employees will be able to choose from any of those plans available from the carrier and pay the difference outside your base plan. Now, one level. So here we are again. I'm going to share the cost of a pizza with you. You tell your employee. But what it is I'm going to share the cost of a pepperoni pizza. So you're telling them what kind of pizza they're going to have to get. They have to get a pepperoni pizza. You look at a couple of pizzerias in the neighborhood and you say, you know what? The business can afford to pay for half of this $10 pepperoni pizza at the pizzeria down the block. Maybe you choose. So this employee now has $5 towards any pepperoni pizza from another pizzeria. So this employee might not like that pizzeria you chose from. They might go to another pizzeria and buy a different pizza. They'll have that $5 that you budgeted towards getting that from any pizzeria. So if the pepperoni pizza is less at another pizzeria, they'll pay a little less than the $5. If the pepperoni pizza is a little bit more, then they'll pay a little bit more than the other half of it, the $5. So with one level, when we talk about health insurance, this is what it looks like. You are choosing the metallic tier, the benefit level, to offer your employees. You then pay into one of the carrier's plans from that metallic tier, and then the employees can buy across carriers. The carrier that you offered might not have their doctor in the network. So what they'll do is they'll look for the carrier that does have their doctors in the network and choose that carrier to enroll in, but they will have to choose from the metallic tier that you chose. So those are employee choice models. Again, they are exclusive to the Health Connector for Business. There's a lot of options you can play around with there. Please feel free to go on and start, quoting and seeing what's available. Money back. How do you get money back through the Health Connector for Business? So let's talk about Connect Well, or wellness rebate program. So for businesses to qualify to be part of the Connect Well program, well, they have to enroll on the Health Connector for Business to begin with. They have to have 25 or fewer enrolled employees. They could have more employees on their roster, but 25 or fewer enrolled employees. And to participate, employees just choose from more than 30 pre-approved qualifying wellness activities. The incentive here is employers can receive a 15% rebate on their contributions towards the premiums if 33% of their employees participate in the wellness activity. And employees are incentivized with a $100 Visa gift card. So if the wellness activity that they participated in is approved, they will receive back a $100 Visa gift card, and you, the business owner, will get back 15% if 33% of your employees do this. And just to let you know, there's a lot of activities available. This is just a sample of the activities. There's more than 30 pre-approved. I think it's floating right around between 30 and 35. And they're, focused on mind, body, and money. So mental, physical, and financial health. And here's just a few samplings of the activity that the employee can do. And again, it just has to be one approved activity. They don't have to do one from each category, just one from any of these categories and get it approved. As you see here, acupuncture, yoga, gym membership, going for their well visit, which is zero cost sharing for them if they have health insurance. So that's great. They'll get a $100 Visa gift card for that. Retirement planning, end of life planning, and there's so many more. And it's available on our website for you to view. We help with the Connect Well process. So I just want to let you know that if your group is eligible, you do not have to ask to be enrolled in Connect Well. You will be automatically enrolled and emailed within 10 days after your plan starts to tell you about the Connect Well program. Employees are also emailed. So we will tell the employees about the Connect Well program. We will tell them to get their $100 Visa gift card. So we will do that on behalf of you. Of course, we would love for you to help and promote it so you can get that 15% rebate before the year end. The employees go ahead and complete their activity. They submit it online. Everything's online, no paperwork. Once their activity has been approved, because if it's not fully filled out, or if there's some items missing, or if it's not the correct activity, we will deny it, but we'll send them an email back and tell them to try again. But once their activity is approved, they will immediately receive the $100 Visa gift card in their email, which is great. And then they'll start talking to their friends about it. Once the group has reached 33% participation, we will let you know that you have hit 33% participation and you are rebate eligible, because you get every other month updates to let you know where you are at. So we'll email you updates on where your group is at. And at the year end, actually a month following the year end, because we give employees an extra month to submit their activities, you will receive a rebate worth 15% of your annual premium contributions after you filled out a little bit of paperwork on direct deposit information and just confirming that the 15% is correct. So we want to see you get this Connect Well rebate, and we definitely help promote it. And if you have a broker, they'll keep you updated also. So just to prove to you that it's real, before we all started working from home, we did have a little campaign where we went out and delivered some of those really big, checks. And so we did deliver this check to Marcy Berger, owner of Clean Properties. And what she said when she received this check was, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So you do have the option to get this if 33% of your employees participate. It's great money back that you can utilize towards anything. So I'm going to talk about the small business healthcare tax credit really quickly, just to let you know why we mentioned this. So we are not tax professionals. We probably won't be able to review any of these items with you, but the key here is the small business healthcare federal tax credit is only available to employers who offer health insurance through a state marketplace. So Health Connector for Business is the Massachusetts state marketplace. So just by that, you should be mentioning to your tax professional, your accountant, whoever sets up your taxes, that you enrolled through a state marketplace as an employer offering your employees health insurance. And they should be looking for all those other requirements. They should be looking for, are you covering 50% of the cost? Do you have fewer than 25 full-time equivalent employees who have average wages of $53,000 or less, and these other items. So the key is, if you enroll on the Health Connector for Business as a business, mention this to your accountant at tax time. Let them see if you are eligible for the small business healthcare tax credit. Now that I've spoken about all of those great options that are available through the Health Connector for Business, you're probably wondering, how do I go and get started? How do I go and see what's available to me? Well, the first thing you'll do is come visit our website, www.mahealthconnected.org/business. And when you come to our website, you probably click on employers, and there's a lot of resources available there. I believe that Ashley has been putting in the chat a couple of links, but once you go to the site, you'll have all of those links available to you. I just want to let you know, as a small group business in Massachusetts, you can offer health insurance for the first of any month. You do not have a closed or open enrollment period, such as like you might be familiar with like January 1st or something like that. If you wanted to start health insurance on July 1st, you can start your group's health insurance on July 1st, and you'll renew the next year on July 1st. It's a full year. So there are some deadlines in the prior month that you have to hit to offer health insurance effective on that first day of the month. So you want to offer the plan in your employer account, which we call publishing plan year, no later than the 10th of the prior month. So that's, you'll set up the benefit package, you'll make sure everything's set up, new hire eligibility, all the employees are in your census, and you'll just click a thing that says publish plan year, and electronically all the employees will receive emails that will tell them to go ahead and create their own accounts and enroll or waive with a valid waiver. Employees have until the 20th of that prior month to make their enrollment decision, either what plan they're enrolling in or if they're waiving with a valid waiver. So that deadline is the 20th. Then we need an online payment, we call it a binder payment, for the 23rd of the prior month. As long as all those deadlines are hit within the proper timing, then the coverage will begin very smoothly on the first of that month that you want it to be effective. I think I mentioned that we have brokers a couple of times. You're a small business owner, so you might not be thinking about health insurance as the top priority, or it might be confusing, or you just might not have time in your day to work on the health insurance benefits. Well, we have over 460 certified brokers on the Health Connector for Business who are available to help you. And there is a find a broker tool on our website, which you can see right there. But why utilize a broker? Well, they're free. You can utilize them for free. There's no cost to you to ask a broker to help you for any Health Connector for Business related items for choosing health and dental. They can provide easy cost estimates. They've got this great quoting tool where they can compare and contrast and show you several different options that are available to you, sit down and talk to you and see what's the best option for you and your employees. This is their business, so they understand plan options. This is what they do day in and day out. So feel free to just kind of tell them what you need and let them find the best plan for your group. And as I said before, I know you're very busy small business owners. You're working on, your area expertise. So utilizing a broker could save you time in this process of choosing a health and dental benefit option for your employees. So feel free to utilize them. They will save you time with the enrollment process, the plan creation, and during the year, any changes to your roster, any employees who might have to enroll or disenroll. And then at renewal time, they help you see if this is the best option to stay there or maybe change to something else. So I have spoken a lot about the small business, and I'll be able to answer questions on that at the end, but I'm going to turn this over to my colleague, Nikki, who will talk a little bit more about what is available to those who cannot get access for health insurance through the Health Connector for Business or any other small group market.
So thanks so much, Shaitra, and thank you all for joining us today. So I want to just spend a little bit of time talking about what solutions we have for sole proprietors, owner only, or if you have any part-time employees, let's say, who aren't eligible for your benefits. So if you want to go on to the next slide. I'll start just by laying the groundwork of Health Connector plans on the individual and family side, and actually all of this actually relates to and is associated with Health Connector for Business. So I think I heard Shaitra mention that You know, there is peace of mind when buying your health insurance coverage through the state's Health Connector. We are the state's marketplace. You know that all of the health insurance plans that we offer, whether you're buying from Health Connector for business or on the individual and family side of the house, they all meet state and federal standards for coverage. So technically, all of the health insurance plans and dental plans that we sell are known as qualified health plans and qualified dental plans. So consumers have the opportunity to choose from a variety of well-known health insurance carriers and plans that are available in the area in which they live. On the individual and family side, there are different ways that people can take advantage of savings, some cost savings. So first, we have through the Health Connector, because we're the state's marketplace, people are able to and get determined for advanced premium tax credits, or APTCs. So basically, if people's income, if someone's income is within a certain range, they could qualify for tax credits that helps reduce the cost of the monthly premium. Another important thing to note here is that due to the American Rescue Plan that was passed last spring, there are more cost savings available to individuals and families. So if somebody had applied before and you didn't find that you were eligible for advanced premium tax credits, not to worry. We have a great tool. There's a get an estimate tool. You can check it out and just kind of see, based on very, very, very quick information about your household size, where you live, and in the age of the people who need coverage, you can get a general sense of what kind of health insurance plans could be available to you and what your costs might be. Now, people in lower income ranges who meet other eligibility requirements can qualify for low or no cost health insurance coverage through our Connector Care plans. And then of course, at the Health Connector, we offer catastrophic plans. And you can see that those are available to people who are 30 years of age or younger, or with a hardship exemption. Now, when thinking about catastrophic plans and you see the pricing there, people may be drawn to them and say, okay, I'd like to buy that because essentially, you know, it's a lower monthly premium, etc. So I just like to caution folks to certainly, if you are, you know, under 30 and considering a catastrophic plan, take a look, but know that the lower monthly premium actually equates to a higher deductible and higher costs at point of service. Now, the next two items on this slide, I think Shaitra talked a little bit about dental coverage as well, but just a reminder, we do have dental plans for individuals, families, children, small employers, etc. And these include pediatric only plans and plans with higher and low deductibles. And then, of course, Shaitra spent quite a bit of time talking to you about all the ins and outs of Health Connector for business in general. So on this slide here, I want to talk a little bit about special enrollment periods, and I want to make a distinction. So as Shaitra mentioned, there is no open or closed enrollment for small employers. However, if you are a sole proprietor, or if you are helping or explaining this to, let's say, an employee who doesn't qualify for your benefits, or a family member or friend, they need to be aware of the Health Connector's open enrollment period, but also that there are qualifying life events that let people enroll in or change health insurance plans when we're outside of that. So, for example, let's say someone's household size goes up or down, their income changes, they have a change in immigration status, or they move, or you can see some other things here, get married, have a baby, etc. All of these things are considered qualifying life events that open a special enrollment period. Now, there are some requirements associated with reporting these events and actually being able to apply and get into coverage. So if you have a qualifying event, it should be reported to us within 30 days. But then you have 60 days from the date of the qualifying event to select a new plan. So these are just some things to keep in mind as you're thinking maybe about somebody you know or yourself who might need some coverage right now. So on to the next slide. In order to apply for individual or family coverage, you'd go to mahealthconnector.org. There are a couple of requirements. As you can see, we need to have Massachusetts residents. People need to be legally here in Massachusetts. So let's say someone is a US citizen, a US national, or otherwise considered lawfully present in the United States. And the person has to not have access to other health insurance. So they need to not have access to employer-sponsored insurance, let's say through a spouse or a partner. Now, if someone is seeking coverage and they have access to, let's say, Medicare or Mass Health or some other type of public coverage, there are certain veterans benefits that would disqualify. These types of coverage disqualify someone from getting access through mahealthconnector.org. So if someone's, as I said, if you have an offer of ESI, yeah, the person is going to be blocked from getting coverage through the Health Connector. So going on to the next slide. In terms of things to collect and gather when you apply for coverage, we recommend that everyone has social security numbers for everyone who's applying, if they have them. Related to that, immigration documents for any non-US citizens. And we have a link on this page to our website, which helps really diagram different various immigration documents. So I've heard from people sometimes that they're like, oh, I have this, I'm not even sure what this document is, etc. This link to our site is actually fantastic. Very, very, very helpful to help you kind of sort out your documents. We will need to know about someone's income, right? When they're applying, if they're applying for help paying for coverage. So we always suggest that people have at least their last 2 pay stubs. If someone is collecting unemployment, we ask to have that information readily available. If you didn't file taxes last year or your income changed since last year, just again, information about your current income and any supporting documentation. And if you're self-employed, we would need information about your net income. Now, one of the things I always like to say in these presentations is that we don't want to discourage you from applying. You know, we have a list of things that we need, but we don't want to discourage you. So if you don't have all this information that we've asked for, just simply apply with what the information you have. And if we're missing something, the state will ask you in the application, it will tell you exactly what information you need to submit. And you'll get a letter that's requesting that as well. So if you have any questions, let's say about income or any of these things, I believe Ashley included some of these links in the chat so you can take a look there. All right, so just briefly, I'll go over this because I think I described this quite a bit already, but there are 2 ways that people can get help. So these advanced premium tax credits, I think I mentioned, they lower the premium amount that you would pay. Important to note here is the IRS is going to send that tax credit that you're eligible for. They send it directly to the insurance company, so you just pay less each month. And then you get to apply all of that tax credit or some. You get to choose how much of that tax credit. Now, I talked a little bit about the Connector Care program as well. This program and these plans are really good, comprehensive plans, very affordable, and we're very proud of this program, and we know people are very happy with this program. So the way in which you are seeing the low premiums for these plans is because we use the federal advanced premium tax credits plus state funds. Those two together reduce the premium amount that consumers pay. So you see that they have low monthly premiums, low out-of-pocket costs, no deductibles. And then people, depending on their household composition, their income, etc., there is a variety, a group of plan types that they could qualify for. And the amount that somebody would be required to pay would vary. So you can see it's as low as $0 to $133 per month. On to the next slide here. Just, I want you to have this as reference, but as you can see, the Connector Care program has very specific income guidelines based on household size and income. But the reason we have the yellow box around advanced premium tax credits is because we don't necessarily have an income cap anymore for APTCs. So if someone's income is over 400% of the federal poverty level, they could technically be eligible for help paying for their health insurance coverage. So I really, really encourage you to take a look at our Get an Estimate tool, enter some of that information, and see if you in fact could qualify for some monthly savings. So on this slide here, I just want to give you a little bit of information about getting help. So similar to what Shaitra shared, there is free help. You can get enrollment assistance through Health Connector customer service. You can also get some support from community partner organizations. So the telephone numbers for customer service are here. Please note that this number, 877-MA-ENROLL, this is a separate call center than Health Connector for Business. So just note that if you are, depending on who you are listening in on this presentation, you might want to call the Health Connector for Business customer service line, or for individuals and families, please call this number. Also links to our website for hours of operation. And totally separate, but still available to help you from application all the way through enrollment. We have trained and certified navigator grantees, as well as certified application counselors who work at hospitals and health centers across the state of Massachusetts. These people speak many languages. They're the languages that reflect the communities in which they serve. So as I said, they can help with the application, but they're also there as you're going through the process. And if you have questions and maybe you need a little support making a payment, or you get a letter that you don't understand and you want some help, these folks can help. Particularly right now, it's highly recommended that you call ahead to schedule an appointment. The pandemic is what it is, as we know. So please do take advantage of the free help, but do call ahead and schedule an appointment so that you can speak to someone and have that calendar, that time blocked off in your calendar. So lastly, just a couple of, and actually, Shaitra, I don't know if you want me to go through these or you want to go through these.
I can go through them. I mean, I think definitely spoke about these before. We have similar deadlines, correct, Nikki? So, if we go to the second bullet point, I spoke about the deadlines for the 10th of the month to publish plan year, the 20th of the month for the employees to create accounts, 23rd of the month for the first payment. Nikki, very similar deadline, correct, for the individual, for the small business employees and owners who do not qualify for health coverage.
You got it. You got it. We follow very, very like parallel paths. So if you are a sole proprietor or individual family shopping for coverage, we're going to need you to do all, to complete your application, do all of your shopping, all your comparison, but select the plan. And then if you're required to make a payment, pay by the 23rd of the month so that the coverage can begin on the 1st of the following month. So payment deadlines, same across the board.
23rd.
You got it.
23rd of the month. If you want health insurance on the 1st of that following month, just remember everything, including the payment, has to be completed by the 23rd for both sides.
Excellent.
All right. I think we're ready for questions. I know you and I took a little bit longer than we proposed, but hopefully we can get in some questions, some good ones, Melissa, in the next 10 minutes.
Looks like we had several really good questions from, yeah, so we'll go ahead and start. The first one, if my business grows beyond 50 employees, would I be able to stay on with the Health Connector for Business?
Yes, at the initial enrollment, it must be 50 or fewer full-time equivalent employees. And then you can stay on till as long as you would like as a business owner.
Do brokers work for specific providers and steer you that way?
No, they are certified brokers on the Health Connector for Business. So they have access to all of the providers that the health insurance plans that you would see also, and will put you in the right place for your contributions that you would like to put and what your employees need.
So these two questions are kind of deal with the same topic. So can we have two plans, one for in-state employees and another for out-of-state employees? Can we have a one carrier model for out-of-state and a one level for another, for our other employees, for instance?
So no, the one, you would have to choose one benefit package for all your employees. So you would, that's the part where it comes into play. Which one should I do? Which one makes the most sense for my employees and what they need? So, in that case, if you have out-of-state employees, it makes the most sense to offer the one carrier so that they have access to the PPO. But everyone has access to the same exact benefit model offer.
Regarding the rebate, I thought that the wellness rebate needed to be used for something that was wellness related, spread across all employees. Or the other option is that the employer shares back with the current employees a piece of the rebate. Please clarify, as we believe the comment was made, that you can do anything you want with it.
That is true. It is your rebate. So during the year, the employees do have to participate in a wellness activity to go towards the participation, but the check is written out to you in the amount of the 15%, and you can do with it as you please.
If I'm a subchapter S corporation, I pay for health insurance through the company and currently am the only employee getting health insurance through the company. I don't understand where I fit between the business and individual connector. I want to keep the health insurance in the company, not switch to getting it as an individual.
Nikki, could you talk a little bit on that?
So I'm trying to, I don't think I'm as familiar with that term. So I don't know, are we talking about an S corp? Can the person just provide a little bit more clarification, or if Shaitra, Melissa, if you?
So I'll try to generalize it a little.
Yeah.
So if you are coming to the Health Connector for Business, you have to have at least one non-owner, which does not include your spouse. Your spouse is considered an owner also, enroll with you at initial enrollment. If you are only an owner only of any kind of corporation or LLC or anything like that, then you would not be able to enroll through the Health Connector for Business. As Nikki spoke on the connector, there is the option to go through the individual and family platform, but there are also other options that you could go through also directly to the carrier or another platform if you so choose. I just know that the the tax credits and all those items, Nikki, that you were talking about are only available through the Health Connector part.
Yes, thank you. I think I was getting thrown off by the distinction of how the companies organized, but absolutely everything you said, Shaitra, is correct. So if you are looking for some assistance paying for your health insurance coverage, you may be able to get those in the form of tax credits, but only if you apply through the individual and family side. You cannot, as Shaitra explained, you cannot apply for and get coverage through Health Connector for Business as the owner only.
So for the Health Connector and for us small businesses, where would we get their 1099 HC?
So I think, so let me help with this a little bit. So at tax time every year, people in Massachusetts are looking for a couple of things. They're looking for their 1099 HCs. Those typically come from the health insurance carrier. And they're looking for 1095s. On the individual and family side, those do come from the Health Connector. Shaitra, for Health Connector for Business, do they get 1095?
From the carrier.
Everything's from the carrier.
So if you're looking for your tax documents and you got health insurance through your employer, through the Health Connector for Business, you would inquire of the carrier that you're enrolled in, where your tax documents are to show that you had health coverage during the year.
I will be starting up a business and will be the sole owner and employee. I don't expect to draw a salary for a few years. Would I be eligible for health insurance through the Health Connector?
The answer here is yes. This is, I feel like Shaitra and I say this every time we're together. We're like, this is the things here, particularly if you're not going to, you don't think you're going to draw a salary for a bit because you've got to start your business up. And then keep us in mind when you start growing that business and you have employees, come over and visit the Health Connector for Business side. So yeah, so definitely take a look at mahealthconnector.org.
Yeah, we always like to say that, Nikki. We can go one way, right? Start it off, get some, go on the individual and family side, get some employees, come over to the Health Connector for Business side, or for whatever reason, you know, you had the business, maybe you're no longer owning the business or whatever, flip back over and go back over to the individual and family side. We work right together, and it's a great little revolution that we see.
And our plans offered through the one carrier model, so available out of state, are they HSA compatible?
I don't know that right off the top of my head. There's usually just one PPO option available from each carrier. So if you go to the mahealthconnector.org/business and you look under employers, there will be a whole health plan information website that you can definitely look at all of the plans that are available for the Health Connector for Business, read their summary of benefits and coverage, read this overview of it, out-of-pocket costs. That would be the best option. I do not know it off the top of my head. I do apologize.
Do we just randomly pick a broker from the list on your site?
That's up to you. If you know a broker, choose a broker you know. If you don't, you can choose one that maybe is in your area or that aligns with what you need, maybe a language or anything like that.
Well, I think that's most of the questions that we received today. Very, very good questions.
And I think we're finishing up right on time. Am I correct, Melissa?
Yep, it looks like it, yes.
All right, perfect. Well, I am very happy with this presentation. Nikki, thank you so much for joining us to explain what was available to, you know, sole props and owner only and part-time employees. I agree with you. I think this is a great platform of ours. It's really one-stop shopping for everyone.
Excellent. Thanks for having me. And thanks so much, everyone, for joining us today.
Have a great afternoon. Thank you.